Hey nurse leaders, imagine waking up more exhausted than when you went to bed. Every small task feels like a marathon, and rest doesn't help. That's the daily reality for those living with chronic fatigue syndrome, also called myalgic encephalomyelitis, or ME/CFS. Today we're exploring what makes this condition so complex, why it's often misunderstood, and how nurses can support patients with compassion and clarity. Myalgic encephalomyelitis, chronic fatigue syndrome, is a chronic multi-system illness characterized by profound fatigue that doesn't improve with rest and worsens with physical or mental exertion. It affects up to 2.5 million people in the US, though many remain undiagnosed. Core symptoms include post-exertional malaise or PEM, a crash in energy and function after minimal activity, unrefreshing sleep or waking up still exhausted, cognitive dysfunction or brain fog, memory issues, difficulty concentrating, orthostatic intolerance or dizziness or worsening symptoms when upright, muscle and joint pain, headaches, flu-like feelings. Symptoms may wax and wane but can also lead to long-term disability. ME/CFS has no definitive lab test. Diagnosis is clinical based on symptom criteria and ruling out other causes. Common barriers include misdiagnosis such as depression or fibromyalgia, skepticism or dismissal of symptoms, stigma due to invisible disability. There's no FDA-approved cure, but management focuses on improving function and quality of life, which include pacing and energy management, also called activity balancing, cognitive behavioral therapy or CBT for coping with chronic illness, sleep hygiene and low-dose medications such as amitriptyline for pain and sleep, graded exercise therapy or JET, once widely recommended now controversial, as it may worsen symptoms for some patients. Supportive therapies include nutrition, stress reduction, adaptive devices, nursing support, advocacy and adaptation. Validate the experience. Fatigue is real, even if labs are normal. Teach energy conservation strategies like the spoon theory. Help patients track symptoms and identify PM triggers, coordinate referrals, sleep specialists, therapists, occupational therapy. Encourage flexibility, not force. Pushing patients too hard can cause harm. Support emotional health. Chronic illness often leads to isolation and depression. Living with ME/CFS isn't about laziness, it's about survival in slow motion. Nurses are vital allies in giving patients permission to rest, adapt, and hope. Have you supported someone with ME/CFS? Drop your encouragement or tips in the comments, like, subscribe, and follow for more chronic illness insights that put empathy into action.